Hi there, Laura Dankoff here from PathToHealthAndHealing.com. Today I want to talk to you about your hormones. A lot of women that I have treated over the years, probably between the ages of 35 to 60 on average, begin to experience a lot of different hormonal changes. And for some women, this can be really distressing. They will have either irregular periods, mood swings, difficulty with sleep, and as they get closer to menopause, they also can start beginning to experience hot flashes and night sweats, and they really just don't feel like themselves. So what do? So you go to your health practitioner and let them know what's going on. They run some labs and really don't either come up with too much or might offer you some hormone replacement therapy. So if this is you and you're in this situation, what are good ways to test your hormones? I'm going to talk about the pros and cons, and what are some different ways to treat hormone imbalances that you may have. And I want to give out my loving disclaimer. Just know that the information I'm about to share with you is for information and educational purposes only and is not a replacement from seeking appropriate medical care from your health practitioner. So first, let's talk about different ways to check your hormones. First, there is blood testing. That's the most conventional way to do hormone testing. When you do a blood test, it is somewhat limited in some ways. It can give you some good general information, and it's been used for a long time, and this certainly is what your insurance will cover. But when you do a blood test for hormones such as estrogen, progesterone, testosterone, thyroid, what you're doing is you're looking at both the active and inactive hormone when you do a blood test. So any hormone that's bound to the cell is inactive, and that's not bound to the cell is the free or active hormone. The unfortunate thing on blood testing, you can get a free hormone level on thyroid and testosterone, but not on estrogen and progesterone or DHEA, for example. You can also get a free cortisol level by doing urine testing. So what you might get there is not a complete picture or total reflection of what may be going on with your hormones, and so you could miss some things. Not only that, you have 3 primary estrogens in your body, and generally the only one that's getting tested is estradiol, also known as E2. What may not be getting tested is estrone, E1, and estriol, E3. The next option is doing saliva testing. Saliva hormone testing has been around for a very long time. Now, you cannot get a thyroid panel doing saliva testing, but you can get cortisol levels. You can get all 3 of those estrogens that I mentioned, progesterone and testosterone, and a DHEA. And this is a good test to look at the free active hormone level. And I've done that test for many, many years and found it much more reflective of what was going on with the person in front of me and how they were feeling. Now, the con to this would be that insurance does not like to pay for this kind of testing, of course, but it is a good test, and it can tell you, is taking hormone replacement right for you, or what are the hormones that maybe your body needs support with. Then more recently, in the last 5 years or so, a dried urine testing has become available. And really this to me is the best way to test your hormones. Again, insurance does not like to pay for this, but what it's going to do, it's going to look at not only the top surface level of your hormones, for instance, your testosterone and cortisols and DHEA and estrogens, but then it's going to look at how those hormones are actually breaking down in your body to their complete forms. This is known as looking at your metabolites of your hormones. And this is a great test. For example, let's say we were going to look at your estrogens. So your estrogens, estrone, estradiol, and estriol, break down further into these metabolites known as 2-OH, 4-OH, and 16-OH for short. But basically what you need to know about that is 2 is more protective, the 4 and 16 are not. So if you have high levels of those, then you, and say a low progesterone, you're very estrogen dominant. And whether you're low in estrogen or high in estrogen, a lot of times your symptoms can be similar. I'll give you a perfect example. Recently I was seeing one of my patients, and she had had a hysterectomy, and the knee-jerk response by the clinician who she was seeing was to put her on estrogen because she was having estrogen-like symptoms, where she was having some, difficulty with sleep. She was having some warm flushes or night sweats. And so that knee-jerk response was to put her on estrogen. Now keep in mind, before her hysterectomy, she was having very heavy bleeding. And this can be a sign of estrogen dominance as well. So a standard blood test looking at her estradiol was in the high normal range. But when we did a dried urine testing on her, she had very low progesterone and very high estrogens. Some of these estrogens, the estrone and the estradiol, they were very high. So putting her on estrogen was actually the wrong thing to do, and what needed to happen was her progesterone needed to be supported, and then we would use certain supplements actually to help bind that excess estrogen to bring it down and to bring her into balance. So now we've talked about the 3 main ways of testing hormones. There's blood testing, there's saliva testing, and there's urine testing. So let's say your hormones are out of balance, then how do we treat that? First and foremost, it's important to look at some key things. What's your stress level? What's your diet like? Are you getting enough sleep at night? And what are some of your genetic risk factors? And once we've looked at some of those things, then if we're moving on to how do I go about balancing a hormone imbalance? Well, first of all, it kind of depends on what the hormone imbalance is. But there are different ways to address that. There's the standard therapies, which is synthetic hormone replacement therapy. And for me personally, that's just not something that I like to use on my patients. I prefer to use things more naturally. So first of all, I may recommend a compounded hormone from a compounding pharmacy. I may recommend herbals, supplements. There's different herbals that we can use to help balance the hormones. Or I may recommend homeopathic or a combination of these things. So it's a very individualized approach to care. It's not a one-size-fits-all approach to care. So I hope that helps you. If you would like to learn more about how to work with me and look at how to balance your hormones, visit me at www.pathtohealthandhealing.com and schedule your consultation today. I would love to help you out and end your suffering. All right, take care and have a good day.